Hi, Jonathan. It's Paige. Do you want to go over some more endoscopy imaging tips this morning?
Hi, Paige. Sure, that would be great.
Okay, here is your scorecard on the Advanced Imaging Learning Program so far. Before we get started, let's see if you remember what we went over last session. Yes, you've got it! Shall we move on to the next imaging lesson in the program, or is there anything specific you want to learn about today?
Paige, I'd like to go over number 4 and learn how to recognize a malignant polyp from its endoscopic appearance.
Okay, this 48-year-old woman comes in for colon cancer screening after her sister just was found to have multiple polyps on a screening colonoscopy. This 2-centimeter polyp is seen in the transverse colon. Can you describe the key features of this polyp that help make an optical diagnosis?
It looks a bit depressed in the middle.
That's right! Depression is one of the key features of this image. Can you describe the color demarcation, microvessels, and microvessel pattern?
This is an NBI image, and the vessels are very thick and dark, especially in the middle.
Yes, this is an NBI image and the vessels are abnormal. Can you assign it a Nice classification and tell me what you think the diagnosis is?
I am not sure about the Nice classification, but I think it is an adenoma.
Actually, this is a malignant Nice 3 polyp. I'm emailing you a link to a reference on the Nice polyp classification. Let's go over the best way to use advanced imaging to assess a polyp and make an optical diagnosis.
It's a critical skill to be able to determine when a polyp has features of advanced histology. When we look at the polyp, we try to find clues, and I'd like you to focus mostly on the vessel appearance and the surface pattern. The vessel appearance and the surface pattern. The vessels in a typical adenoma are uniform and surround white structures. When the vessels themselves get very thick, irregular, or even an absence altogether of the vessels, you worry for advanced histology. Second, the topography of the polyp. If you see a distortion or an absence of a mucosal pattern, or in particular, I want you to focus on a central surface depression. These suggest a type 3 Nice lesion or a submucosal invasive cancer. Look at this adenoma, a Nice 2 lesion, with uniform dark vessels highlighted with a narrowband imaging and near focus, surrounding the normal the pits that are Kudo, type 2L, classic for a tubular adenoma. Now look at the shape of the vessels and the pattern of the vessels in this advanced polyp. You see here the vessels are very, very thick. They're in disarray, disorderly in this area. And then if you look at the topography of these things, you see in this other lesion, you see, just like in that, a depression. The depression, you can see it here pretty nicely. And then if you look at the vessels here are very thick in this area and quite in disarray. And for these two reasons, this lesion that you've detected is a advanced lesion with superficial adenocarcinoma requiring special attention in terms of management.
Okay, let's see how well you understand this material. Here's a quick question for you to answer. Great job! Let me review the wrong answers. This polyp indeed has NBI features, highly suspicious for malignancy. The raised outer borders and center depression of the topography giving it a Paris type 02A+C classification, along with the microvessels in the depressed portion that are both thickened and in a highly disordered pattern, indicated advanced Nice 3 histology, likely an adenocarcinoma, not a Nice 2 tubular adenoma. While surgical referral might be appropriate if local expertise is lacking, full thickness resection of this 2-centimeter lesion or en bloc endoscopic mucosal resection, EMR, or submucosal dissection should all be possible and reasonable next steps. I'm sending you a link to a key paper on the management approach to malignant polyps, so you can review this material more in depth. Jonathan, if you want to see a video illustration of how this new information can be put to use, check out this article from Video GIE. Jonathan, If you are interested in diving deeper in the area of imaging in the management of malignant polyps, I'll send you the link to the ASGE STAR Lower EMR hands-on course and to the Olympus Continuum Training Workshop program, so you can find out more and register online. Check out this ad from Olympus about their latest generation processor and new imaging technologies. If you want to learn more or connect with a representative, just click the link. Is there anything else I can help you with right now?
No thanks, I've got to get back to work.
Okay, Jonathan, great work today. Next time, maybe we can dive into the Paris classification. See you next week, unless you want to reach out to me sooner to learn more.